So let's talk about the 7 phases that you'll see for most protocols that you have downloaded. The first phase is going to be your maximum protection phase. That phase is very important. In this phase, you want to make sure that you manage swelling, pain, as well as protect what the surgeon has reconstructed or repaired. Here, you're focusing on range of motion, pain management, muscle activation early on, and just making sure that the patient understands what is at stake in terms of this particular phase. In phase 2, which is protection phase, you don't have to be as cautious as you were in maximum protection. In this particular phase, you will start to progress some of the exercises that you did from phase 1. You will continue some of the exercises that you did for phase 1, but everything is still low level. Still working on range of motion, low level strengthening exercises, and again, managing pain and swelling. Phase 3, that is our functional restoration phase. So now we're not protecting as much as we were previously. We're trying to get back some of the things that we usually do on a day-to-day basis that will make them more comfortable with ADLs, right? And so that is if it's a knee or a lower body, a lower extremity type of surgery, then we're trying to get them to walk normal. We're trying to work on stairs, getting in and out of a chair, and then focusing on still range of motion and strength deficits. Phase 4, that is our progressive overload phase. In that phase, now we're trying to build up the muscular endurance with these exercises. So exercises are going to be progressed, but more importantly, the volume is going to be progressed. Now that they are able to do squats, walking, going up and down stairs, you're adding layers to this particular, in this particular phase that you weren't able to do in functional restoration phase when you introduced them to these movements. Progressive overload, phase 4 is going to focus on increasing the volume. How many reps can they do correctly before they start to fatigue? So that muscular endurance is a very important focus here, as well as still, if there are any range of motion deficits, that's priority, and you're making sure that you can finish those. Make sure that you're getting 95 to close to 100% of their range of motion back. Phase 5, intro to impact, a very important phase. This phase, don't rush to get to it and don't rush to get out of this phase. This is where they are finally able to start jogging. So intro to impact, jumping, landing, hopping. Be careful with these because they can cause pain and discomfort for some of your lower extremity type of surgeries. So be careful, make sure you're focusing on form and progressively introducing them back to impact. Force absorption is very key, and they have to demonstrate a certain level of confidence and strength. So they have to lift a little bit heavier in this particular phase in order to be able to absorb forces. Phase 6, deceleration. Before they can start deceleration, they have to be able to pass phase 5 and pass it without any compensation. So running, landing, jumping, those things. Because in deceleration phase 6, they have to have the strength, or they have to lift heavier in this particular phase in order to be able to slow down their momentum required to decelerate and cut and change the direction properly and safely. In phase 7, this is our return to sport phase. Here, you're focusing on introducing them to sport-specific movements and slowly introducing them back to their sport, non-contact, but still increasing the amount of movements, repetition, and variability in their particular training and rehab. So therefore, they are more comfortable once they get back to their sport. So those are your 7 phases.